When working with a patient with neurological injury, the kind of treatment that you choose depends on what the problem is. If you have a patient in front of you, no matter what setting you're in, you're going to do a examination or evaluation of that patient. If the patient is in their optimal condition, then no therapy is needed. But if they're in physical therapy for a reason, they either need some strengthening and conditioning or they have a neurological problem. Now, if it's strengthening and conditioning, you can use progressive resistance exercises, you can use PNF, you can use E-stim, core stability, any kind of aerobic training, whether it's upper extremity or lower extremity, depending on what the patient has available for use, or you can use simple flexibility. If it's a neurological problem, your decision is either to remediate the problem and go for return of function, or you can compensate. You can compensate at the level of impairment, functional limitation, and participation, and you can remediate at all of those as well. Whether you choose to compensate or remediate for a particular problem, it depends on the patient diagnosis, whether you think that there's any functional return that's possible. If, for example, you have a patient that has had a recent stroke and they have 0 to 5 strength in their dorsiflexors, you at that time might choose to try and remediate by doing some sort of task-specific training or practice, some sort of E-stim might help, just to get that muscle back again. Whereas if it's a person who's many years out of stroke and they still have foot drop without any return of strength in the dorsiflexors, then you might want to consider orthotics. This slide just shows a variety of different ways where you can remediate patient problems, or you may choose to compensate if the person is out of therapy time or they're not showing any functional return and recovery. So both are available to us as therapists, and we need to know that all of these options are available for our patients.